am so excited to be speaking to this beautiful, amazing group of women. Today's topic is so important. This subject affects everyone. It affects males, it affects females, because women live with men. And so today we're going to be talking about menopause, the big E, which is estrogen, and how that is going to affect you, or how it might already be affecting you. I want you to come away from this conversation understanding how to recognize the signs of menopause and when to seek treatment. I received a couple of questions about menopause. The first one being, what is menopause? So I want to make sure that I answer those questions. Before we talk about menopause, the first thing we need to do is we need to understand estrogen and the role of estrogen in our bodies. Estrogen is a sex hormone. It is a female reproductive sex hormone, and it's produced in our ovaries. Over time, you lose follicles, you lose eggs, and then with time and age, you start to decrease the amount of estrogen that is produced. Why is that important? We need estrogen to function. We have receptors for estrogen on our brain, on our heart, on our tissues, on our hair, skin. We have estrogen receptors on our female reproductive organs, our breasts and other female reproductive organs. We have estrogen receptors on our bone. And so as you can imagine, when you get to a point where you're not producing as much estrogen because of the decline in follicles, you can imagine that your body is going to feel the effects of no longer having that estrogen. Next, we're going to talk about menopause. What exactly is menopause? Menopause is cessation of your menses, not having a menstrual cycle for 12 months or more. The stage leading up to menopause is called perimenopause. Menopause, where you haven't had a cycle for over 12 months, typically happens on average at the age of 51. For Black women, we know that Black women actually tend to have earlier menopause. We tend to have menopause about 2 years earlier than the rest of the population. Black women also have more severe symptoms in menopause. So let's talk a little bit about the symptoms of menopause and how to recognize what that looks like for you. Symptoms of menopause actually correlate with the receptors of estrogen. And so with menopause, you'll start to see hot flashes everywhere at night, throughout the day. People also tend to experience brain fog, anxiety, and that's because we have estrogen receptors in our brain, right? So you tend to have anxiety, you might feel depressed. A lot of women come to me and they tell me, "Doctor, I just don't feel like myself." Because of this, we think that menopausal symptoms is actually a leading cause of women just leaving the workforce. A lot of women get put on antidepressants when they become menopausal. The real issue is that they're actually missing the estrogen. In addition to hot flashes, mood swings, anxiety, women may also experience vaginal dryness, pain with intercourse, loss of libido. Some other really important things that happen when you lose estrogen is there's also a decrease in your bone mass. So that means an increase of fractures because of osteoporosis and osteopenia. Remember, we do have estrogen receptors on our bones. Another really important thing that we don't talk enough about is the effect of menopause on our heart and our cardiovascular system. We know that we have estrogen receptors on our heart and on our blood vessels. We think estrogen has an anti-inflammatory effect. We do see that estrogen is actually cardioprotective. So that means estrogen is used to help protect your heart. And so as you can imagine, if you're a woman and you've gone through your whole life with estrogen and all of a sudden you lose that estrogen, whether it be from menopause, natural menopause, because it is a natural thing to happen, or whether it's surgical menopause where you've lost your ovaries, losing that estrogen can cause a lot of problems. So because I'm speaking to a group of wonderful and beautiful women who have chosen to embrace their beauty, their natural inner beauty and outer beauty, who've chosen to be confident, I did want to talk a little bit about the effects of estrogen on your hair. We know that estrogen is needed to keep the hair in the growth phase longer. And so we do see that that loss of estrogen can actually precipitate or make alopecia worse or make hair loss worse. We see female pattern balding, which can also happen whenever women lose estrogen. So those are all menopausal symptoms. What is the difference between menopause and perimenopause? Like I said, perimenopause is the time period leading up to menopause, and perimenopause can start as early as 35. So basically, as your egg supply is declining and your body isn't producing as much estrogen, your brain is sending signals to the ovaries to say, produce estrogen, produce as much as you can. And because of this, we have huge fluctuations of estrogen. And you see that in perimenopause. You have huge hormone shifts, and people can have different symptoms from irregular cycles to spotting to mood issues. So many things can happen in the perimenopausal stage, but you don't exactly reach menopause until you have not had a cycle for 1 year or 12 months, or if you've had surgical menopause where they've removed the uterus and also the ovary. So why is it so important that we're talking about this today? Because people are at an increased risk for so many preventable diseases: heart disease, osteoporosis, fractures, fall. People are leaving the workforce early because of the brain fog, the fatigue, the anxiety that you feel because your body's not getting the estrogen that it needs. So what can you do to take action for your health today? What you can do is you can talk to your doctor about your options. If you're experiencing any of these symptoms, if you're in the perimenopausal age or the menopausal age, talk to your doctor about your symptoms and what's the best way to optimize your health. Of course, you can do things to prevent worsening symptoms of menopause. So things that we can do to prevent triggers would be decreasing the amount of caffeine that we drink, making sure that we're getting enough sleep, making sure that we're physically active, and then also having an anti-inflammatory diet, which means cutting out refined foods, limiting red meats, limiting dairy or anything that causes inflammation. But you definitely want to make sure you take some time to talk to your doctor about what you can do in this stage to optimize your health, and also ask if you would be a candidate for hormone replacement therapy. So let's talk about the treatment for menopause. And remember, menopause is not a disease state. It's something that's naturally occurring, but there are treatment options to help you through that transition period. Women will spend half of their life to 1/3 of their life in menopause. We want to make sure that we are optimized during that time period. So how do we treat menopause? We replace the estrogen. You replace the estrogen, and there's so many options for hormone replacement therapy. There are patches, lotions, gels, vaginal rings, so many options. And there are some people that are great candidates for hormone replacement therapy and others that maybe aren't the best candidate for hormone replacement therapy. That's something that you would talk to your doctor about. But I will say that women that have been treated with hormone replacement therapy, it's been life-saving for many of my patients. Another question that I got was, how do I find a doctor? Well, I will say not every doctor has been trained on hormone replacement therapy. One of the best places to go to find a doctor trained in hormone replacement therapy would be the menopausesociety.org or the North American Menopause Society. Those are great resources, great areas to find physicians that are certified menopause practitioners. In closing, I want to let you know that menopause is not the end. It is only the beginning. It's the beginning of you stepping into your higher self, your self that's wisdom. And for some people, it's the We Do Not Care Club. And I want you to be empowered as you step into that, to let it be the healthiest season for yourself. I want you to advocate for yourself when you get to the doctor. This is not an issue that needs to be pushed behind your other medical conditions, because it can actually be related to other medical conditions. And so I want you to advocate for yourself. If your doctor's unsure about how to treat you, ask them for a referral. If they're not able to address the menopausal symptoms in the first visit, then go back. It's an ongoing discussion. And so I just want everyone to empower themselves to take care of themselves, to take back their health. If you have questions, I'm open to answer questions that you might have. My email is admin@lilyprimarycare.com. It's been such an honor to talk to you ladies today about menopause. So use this information, spread it amongst your friends and family, and use this time to take charge of your health. Hello, beautiful women. My name is Dr. Adesolo Oyewole. I'm a board-certified family medicine physician in Houston, Texas, the owner of Lily Primary Care.